Welcome to Parenting Unscripted. I am your host, Katie Collett. So glad you are with us today. And hey, I'd like to say a big thank you to Norfolk Public Schools for sponsoring this episode of Parenting Unscripted. We all know it is back to school season. Hard to believe it is that time, but it is. So of course, we are focused on school supplies and buying clothes for our kids. But something else that we really need to be focused on is their health and getting them physically and mentally ready to head back to school. So who better to chat with than one of the experts, Dr. Leah Rowland. She is a pediatrician with CHKD with pediatric specialists. Thank you so much for joining us today.
Thanks for having me.
Yeah, we're going to have a great conversation, and I sincerely appreciate you being here. First of all, though, I need to read one line from your bio because it made my whole entire heart melt. And it says, Dr. Rowland is married to a physician and has 3 small children who teach her more about pediatrics than she could ever learn in books and who bring her more happiness than she thought possible. I love that so much. And, you know, I want to ask you about that because I always said once I became a mom, I felt like I became a better journalist because there was just some new emotion in me that just unlocked that I didn't even know was possible to have. So how have you found that your children, becoming a mom, I should say, has helped you with being a pediatrician?
Well, that's a great question. I think kids teach us every single day. And actually, since that bio was written, my kids have grown quite a bit. So they're now in their teen years and entering adulthood. But every time I take care of kids in my office, I remember exactly what it's like to be in that stage of having a newborn. And I think it's so fortunate that something awakens in us as a parent when we have a child. Somehow we develop more patience with our own children than we might have with other people's children. We develop a toleration for all kinds of spills all over us.
Oh my gosh.
Staying up late, lack of sleep. And it's all worth it because we love them so much. And I think my own kids keep it real with me. Yes. They have told me at times, Mom, I cannot believe you're a pediatrician. Like, I would think that you would get this already. So I'm still learning along with my parents. And I like to remind that when I'm taking care of my families in the office that I don't know everything either, and I'm learning with them, and that's okay to feel lost sometimes. So
I love to hear that in every profession, just keep learning and growing with whatever changes. And I mean, you hear different slang phrases and different terminology from kids that you have no idea initially what it means. So you have to continue to grow and learn with them at all times. But thank you for that. I love to hear that even for a pediatrician, becoming a mom has made that something for you that, you know, you learn something new every day. I think that's fantastic. But of course, I have you in here because we have to talk about going back to school. What would you say are your top 3 things that you want parents to know about preparing their child for a healthy school year?
Well, in addition to making sure you're staying on top of your well visits and vaccinations, I would add, as far as in the home, the things that you can do is try to set up a good situation for healthy eating. That's a big one because you are the supplier of the food in the house. Chances are your child is not the one going and picking out the groceries. So if it's in the house, it's going to be a temptation for them. So we know about 40% of what kids are eating these days are ultra processed foods.
Yes.
So the more we can do real foods, stick to those, that helps a lot.
May I ask, I want to jump in for one moment because parents a lot of times will hear ultra processed foods. Can you give some examples of that, the top ultra processed foods that you notice some kids might be eating?
Absolutely. I would say top one are juices and fake beverages.
Oh, wow.
And those can be a trap for kids as far as sugars and things. And I would think about anything in a package where you read the ingredients and half of the ingredients, you're not really sure what they are. That's going to be ultra processed. And one lesson that I think we share is sometimes go around the perimeter of the grocery store, and that's where you're going to find more of the less processed foods. Yeah. So an apple doesn't really have a label on it, right? And so try to stick to the foods with fewer ingredients, more fresh things.
Gotcha. And food is supposed to go bad. It's not supposed to last for 8 years. I guess that's kind of how you know.
That's
all right. So I interrupted.
Right.
So that was number one. What is the second thing that you want parents to focus on?
Sleep is a big one. We know if kids are getting good sleep, they're able to concentrate in school, their mood is going to be better. Everything just goes better when kids are rested. The parents of little kids know this best of all, but it really does apply as they get older into their middle school and teen years. And so whatever you can do as a parent to help preserve your kids' sleep, is really going to go a long way. And I would say a couple of things with that. One would be help your child, and this is a bit age dependent, but help them achieve the environment that they need to get good sleep. So that might mean being the one to say the screens have to be off an hour and a half before bed, that kind of thing. So that's your job as a parent, to try to create some of that structure to get them to have good sleep.
Sometimes you just have to be the bad guy, which is put the devices down. It's hard because that can be a battle sometimes. But yeah, it's so necessary to put those screens down. I do want to go back to the food because I know that, there are some really obviously very picky eaters out there. My son, fairly picky eater too, but we have finally, he'll do chicken, pork, broccoli, peas. We've managed to expand his palate a bit. But what are some things that you would like to see children eating before they go to school to try to make sure that they're full and ready for the school day?
That's a great question, especially because depending on the age, sometimes they get up and they really don't feel like eating breakfast, and that can be a tricky one. So I would say, again, try to stick to the real foods. Find something that has some protein in it, isn't going to be immediately in and out of their system and kind of last them through lunch, towards lunch. So try to find something that is quick, easy to access. There are parents that are able to put together some overnight oats so they can grab it in the morning. There's lots of tips and tricks out there. So really, if you kind of do a search for a healthy breakfast, you're going to find some ideas, hard-boiled eggs, things like that. But brainstorm with your child, have them be involved, because there's no point in you going to the labor of making overnight oats if your teenager doesn't want it.
That's very true.
So involve your child and let them know why you're asking. And usually then things will go a bit better.
Yeah, I think that's a good idea to get them involved as well, because then, you can talk about it and you can say, hey, this is what you said you wanted to eat. Here it is.
Exactly.
On the other side of the break, we're going to pick back up, talking a little bit more about picky eaters and some options for them. So everyone just stay with us and we will be right back.
Whether you're already working in education or aspiring to, then say yes to NPS. Norfolk Public Schools are currently hiring in the following positions. NPS offers the highest salaries and sign-on bonuses in Hampton Roads, plus a work lifestyle you'll love. Say yes to NPS.
To Parenting Unscripted. I am your host, Katie Collett, and we are sure glad that you are with us today because we are talking about the big thing right now, and that is back to school. And we are laser focused on the health of our children when it comes to returning to school. Again, we have Dr. Leah Rowland, a pediatric specialist, that's a part of CHKD, with us today. And Dr. Rowland, we were talking about different options for our kids for food. And I know that parents are they're just constantly trying to find ways to find something that their children will enjoy. And you had mentioned getting kids involved. So let's talk about options for their hydration that kids may enjoy as well. What are some of the best things that you can think of for them?
Well, most children, if they're able to drink milk, we encourage some milk intake throughout the day because that really is helpful for their calcium. Okay. Now, some children just can't tolerate it. So brainstorm with your pediatrician about other options for healthy intake of calcium. And then in general, I would stay away from all sweetened and artificial beverages. Yeah. Just get them used to water. And sometimes kids care more about the water bottle that they're carrying around than what's in it. So you can make it fun, help them pick their water bottle. And if you make water the standard and they see you drinking the water, then usually they'll stop asking for all the sweet stuff. If it's not in the house and you don't drink it either, it should work out.
There's such a big trend right now about the electrolyte powders that you can mix into the water. What are your thoughts on that? And is it true? Will that help absorb hydration or make you more hydrated?
I would say that those in general, I would give to more of our really high-powered, serious athletes.
Okay.
So most children, if they're eating a general healthy diet, even if they're getting some exercise, do not require those. We're talking about maybe our football players that are out all day long in the heat and they really need to replenish electrolytes. And that's also a great question to ask your pediatrician. Should my child get some electrolytes? But in general, most children can get by just with water if they're eating healthy food.
Water is the way to go. Makes total sense. Are there differences in how you would prepare, say, an elementary child health-wise versus middle school to high school?
Absolutely. So if we're talking about going back to school, anyone who's had a little one go back to school, you're going to be more hands-on. You're going to look at their school supply list and take them around and find new pants that fit because they grew over the summer.
Good luck.
And you're going to be doing a little bit more. And then your middle school age, I would say, they're going to start to be more involved and they should be more involved. So this is where you start to step back as a parent and sort of be an advisor, but let them do more of the preparation, what they need and picking things out. In high school, hopefully they're going to be more about what do they need, what, we're stepping back. And then I would say for all ages, part of parenting is preparing yourself. And checking in with where you are. So I know in middle school, and we are inundated with so much information as parents, right?
Yes.
We get sometimes too much access to every single grade our child has.
Everything.
And the kids sometimes are like, back off, I've got it, And sometimes even when they don't have it, it's important to let them not have it.
Yeah.
And so, because that's how they grow. And so one of the best books I read when my child was in middle school was called The Gift of Failure.
Oh.
And I think that type of, so preparing yourself, reading what you need to read, recognizing your own anxieties and your own expectations for your children and how that might affect them can really be a helpful preparation for back to school. Because if you're calm and you're supportive of your kid and you're not expecting, every single grade to be in there on time, on perfect, it drives the teachers crazy too, because sometimes they just haven't entered the grade yet, then your child is going to be more relaxed and do better. And then we can also learn to ask questions instead of, did you get a good grade on this? Or did you sign up for this? We can say, how was your day? What was funny about your day? What did you find interesting? And kids will more tend to open up and talk a little bit more. And then respecting when they don't necessarily want to talk.
Right.
We have to look for that. So I would add parent preparation into the back to school list.
And as a parent, it's hard when you ask your child about their day and, they're like, it was good. So, very specifically, I'm a journalist and I can get people to answer questions, but to get my then 11-year-old sometimes to talk about his day, he just wouldn't. And then I would have another mom be like, hey, did you hear X, Y, and Z? And I'd be like, as a matter of fact, I did not.
That's right.
You just have to really be prepared for your child to be like, meh, it was cool.
And if they seem okay and there's not, listen to your own radar. If you think something bad is going on with your kid, then you might, change direction and really sit down with them. But giving them space is a good thing. And every child is different. We all have the talker in the house and the one that's, I'm good, I'm fine, I'll school.
Fine. Right, of course. And they're just fine. You're right. I love how it's just kind of give them a minute. Hygiene is huge on so many different levels, I believe. Why don't we talk about the importance of hand washing, but when you have your littlest one getting ready to go to school, what do you recommend when it comes to getting them prepared to finally take care of themselves with that type of hygiene?
Well, I would say if you're talking about hygiene, like at school, a lot of schools are really great about supporting that in general, hand washing before and after going to the bathroom or before lunch. And then talking to them about having their own water bottle, I think that's very handy throughout the day. And then not sharing food if possible at school. So you do your best as far as the school situation. And then at home, we're all, brushing your teeth. Having a routine sometimes helps hygiene just happen. If they do the same thing at the same time every day, then we have to think about it less. So that's as far as elementary.
Middle school, which is where my son just went. We have about a minute for this portion, but what are some of the aspects of hygiene that you need for middle school boys and girls?
I would say boys and girls, it's a bit different, and every personality is different.
Yeah.
So I think that's just sometimes where you get out the books about body book for boys, body book for girls, and you start to talk about deodorant and washing your face and those types of things. And sometimes they'll just listen and go with it, and they do all those important things. And other times, they might have the gym teacher say, here's some deodorant. Let's pass it around to all the boys.
Can I just
I've heard
tell
that
you,
happen too.
Bless the gym teachers.
Absolutely.
Because my son's gym teacher was straight out at orientation, was like, it has to be deodorant and antiperspirant. And she's like, please tell your child that Axe body spray with none of the other things just smells like BO with Axe body spray. She was hilarious. But PE teachers are really the ones that are like, they're going to war for this.
That's right.
And it's so important. So PE teachers are amazing. On the other side of the break, we are going to talk about vaccines and the importance of those when it comes to going back to school, and of course their safety as well. So we will be right back to continue our conversation with Dr. Leah Rowland of CHKD. Welcome back to Parenting Unscripted, where we are continuing our conversation about getting ready to send our kids back to school happy and healthy. Again, I am joined by Dr. Leah Rowland of Pediatric Specialists. And let's focus now on vaccines. We know that there are required vaccines for different age groups. What vaccines are, I know that there are a lot, so we can kind of narrow it down, but the vaccines that are required for kindergartners versus kids going into middle school.
I would say that we usually think about it as entering kindergarten. There's some vaccinations then, and then entering 7th grade, and then also going on to your senior year. Mm-hmm. And I would say the best place to look at it all is just going to be on the VDH or VDOE's website, because there's a long list. But what I like to emphasize with my families is not as much the requirements, but more, why are we doing this for your child?
Yes.
Why would this particular vaccine benefit your child? And so I think that's a very important conversation for families to have with their pediatrician with every vaccination that we have. Mm-hmm. And then one that I would emphasize for every school year would be the flu vaccine in the fall. Mm-hmm. As it does reduce risk of serious illness and death. And we want to keep our kids in school and keep them healthy. And so that's a great one to get. Usually are going to be looking for that in September and October.
Yeah. Do you still recommend kids get the COVID vaccine as well? Since I know that a lot of people are like, well, COVID is kind of like a flu now. Obviously, it's not the flu. It's different. But do you still recommend that as well?
I talk to my families each individually about that because there's so many questions around that particular vaccine.
Right.
We do know that the primary series reduces risk of serious illness, but every child is a bit different. So usually I'll just sit down with the individual family, answer their question, and direct my recommendations for that particular child.
There's a lot of misinformation lately that has been going around about vaccines and whether or not they're safe and whether or not people should get them. And, I think of the measles outbreak that's been happening recently. What do you let your parents know that might be a little anxious when it's vaccine time because of this information that's out there?
Yes, it's so unfortunate. There's so much misinformation out there because we actually have fantastic scientific data over many, many years about the safety of each of the vaccines that we are recommending. And so I try to meet my families and figure out what are their particular concerns, because there's always something just a little bit different with each family. And so I try to listen first and figure out what they're concerned about. And then I can help them with whatever information that I have to make them feel more comfortable. Because I feel like parents have so much to worry about, social media, all kinds of things out there. Vaccines should be a no-brainer for families, that this is out there to help keep your child safe and well, and the evidence is there. Sometimes families who want to read a bit more, I will refer them to some really great websites such as the AAP.org or immunize.org or healthychildren.org. And that way they can go and read a bit more. But really the best thing is to have a conversation with your pediatrician that you trust.
Ask the questions that you're unsure of. That
That's
makes
right.
sense. How about allergies? When you're sending your child to school and they're a child who may have a severe allergy to peanuts or latex, or there's, an issue that they may come across, what is the best way to teach them to communicate to their school nurse or to their teachers that they may need help at a certain point?
We're so fortunate that our schools in Virginia are really incredible about helping children who have food allergies. So when, a while ago, it was hit or miss what was going on, but they've really standardized care. And so the school nurses are just absolutely fantastic as partners for pediatricians and families. And so if a child there's a concern about them going back to school, there's not only a form that we fill out as pediatricians, an action plan, so that if there would be an allergy in the school, there's a plan for that individual child on file with the school nurse. That includes an epinephrine injector. And we talk about that at the visit. But if the parent is still a bit nervous, I would just encourage them to make contact with the school, who likely knows exactly what they'll need to do.
They're the pros too when it comes to this.
That's right.
How about the mental health of your child? You always want them to have a great time during the school year, but what are some signs that parents need to look out for that maybe their child is struggling a little bit?
I would say there's several. One could be just sheer exhaustion and high pressure. So sometimes our highest performing kids are really struggling, and they can be missed because they could be straight A's in all the different sports, and somebody needs to put on the brakes for them and give them more time. Sometimes it's isolation. So if you see a child start to isolate in their room and they're not getting out, they're not participating in their normal activities, or they don't want to go to school avoidance, the things that they normally would do, they're not doing anymore, or they're looking like they're not enjoying anymore. And parents know their kids. So if you're paying attention, you'll probably see some signs of this. And if you're getting one-word answers, how are you doing, and you're not getting anywhere, sometimes bringing them into the pediatrician will open up some conversations. There are a lot of screens that we can do for anxiety and depression in our offices. And we can sometimes be a resource for families for figuring out what's going on.
And, when you think of anxiety and depression, of course, we do tend to think of the link to screen time, social media. What are your recommendations for parents when it comes to those two things?
Delaying the smartphone as long as possible. It's very, very difficult.
Yes.
Because this is how the kids communicate. But don't be shy about trying. My kids would probably call you later and tell you how awful I have been. No, I'm just kidding. But I mean, it's very hard, but I think that you do your best. I think schools, fortunately, are really reducing the amount of cell phone use in the schools. That was passed last year, and that was fantastic. So whatever you can do to keep the time down or delay social media. So some of these kids are getting access to Instagram as 10, 11-year-olds, and they're spending so much time on it. And we know that's connected to decreased mental health.
Right.
So really whatever you can do to kind of limit the time and monitor, be aware of what's going on, that is going to be helpful.
All right, Dr. Rowland, what a great conversation today. I thank you so much. I know that pediatricians are so busy, but just chiseling out some time in your day for this to help us get everyone ready to go back to school. I sincerely appreciate it. It's been so informative. So thank you. And parents out there, I hope that you enjoyed our discussion today with Dr. Leah Rowland, a pediatric specialist, which is a part of CHKD. I would also like to thank Norfolk Public Schools for sponsoring this episode of Parenting Unscripted. And remember, new episodes of Parenting Unscripted air on Wavy Plus every Tuesday morning at 9 o'clock. I hope you're ready for a great school year. Be good.